Hello, this is Dr. Grande. Today's question is, what are the symptoms of schizophrenia? When we talk about the symptoms associated with schizophrenia, we first need to understand that schizophrenia has three phases. When we think of the most severe symptoms, like hallucinations and delusions, we're usually talking about the active phase, sometimes referred to as the acute phase of schizophrenia. Schizophrenia also has a prodromal phase and a residual phase as well. So going back to the active phase or the acute phase, the symptoms we would expect to see here could include hallucinations, delusions, disorganized speech, disorganized or catatonic behavior, and negative symptoms. Now, negative symptoms include diminished emotional expression and avolition. Avolition is a reduced interest in pursuing goals. It's a reduction in goal-directed behavior. Now, in the prodromal phase, so before an acute phase, the period before an acute phase, we would expect to see odd beliefs like ideas of reference, unusual perceptions, but not rising to the level of a delusion or hallucination, vague speech, but not incoherent, and we would still expect to see negative symptoms, the avolition. Now, it's interesting to note here, if we look at the ideas of reference, the odd beliefs, the unusual perception, and the vague speech, we also see these symptoms in schizotypal personality disorder. So you could make a good argument that the prodromal phase of schizophrenia looks a lot like schizotypal personality disorder. Now, oftentimes we see those same symptoms in the residual phase as well. So before and after the acute phase, we see these symptoms like unusual perceptions and odd thinking. Now, in general, across all the phases of schizophrenia, we often see dysphoric mood, so depression and or anxiety. We see inappropriate affect, for example, laughing at something that's not funny. We see a decreased interest in food or eating and a sleep disturbance. Also, cognitive deficits are fairly common with schizophrenia, like slower processing speed, difficulty with memory, and difficulty correctly using language. Hostility and aggression are sometimes associated with schizophrenia, although it's important to note here that the vast majority of individuals with schizophrenia are not aggressive, and spontaneous aggression, random assaults for instance, are not very common. Suicidal behavior, however, is unfortunately very common with schizophrenia, and 5 to 6% of individuals with schizophrenia will die by suicide. Also, 20% of individuals with schizophrenia will at some point attempt suicide. The suicidal risk is always pronounced for schizophrenia throughout the whole course of the illness, but it's more pronounced after being released from a psychiatric inpatient facility and after a psychotic episode. Another element that's important to understand about schizophrenia is the concept of anosognosia. Now, anosognosia is a lack of insight. So this is when an individual with schizophrenia is really unaware that they have this illness, schizophrenia, or any illness. And anosognosia is a strong predictor of non-adherence to treatment, meaning when anosognosia is present, non-adherence to treatment increases. And of course, the treatment outcomes decrease. So this lack of insight, this not being aware that the illness is there, this is a sign that treatment may not be as successful and engagement in treatment may be lower. So this is something to look out for when we are attempting to treat individuals with schizophrenia. The onset of schizophrenia typically occurs somewhere between the late teens and early 30s, although it can appear later. It affects about 0.5% of the population. And the symptoms do tend to be persistent, although it does go through phases I mentioned before. Although treatments like medication and psychotherapy can improve some of the symptoms of schizophrenia. I hope you found this description of the symptoms of schizophrenia to be interesting. Thanks for watching.